Hi, welcome all to Treat DM 2025. Myself, Dr. Prakash from Daikon Hospital. Here is Dr. Bhaskar S. Rao, consultant cardiologist and cardiac electrophysiologist, Jadava Institute of Cardiovascular Science and Research Center, Bangalore. Sir, today you had given a wonderful present on role of aspirin and clopidogrel in the routine practice. Here is a question. Lots of discussion on this. Can you give a clear message on what to use, when and for how long?
Thank you. Thank you for the kind words. So basically for aspirin and for clopidogrel, let me combine it with all the other P2Y12 inhibitors. Aspirin is the gold standard for any ACS, whether it's STEMI or NSTEMI. It has to be started with loading dose.
Yes, sir.
And it has to be continued at least for a month, if not indefinitely, for as a part of DAPT, right? With a lower dose. The preferable dose is 75 now. We've reduced it from a higher dose to 75 because the risks outweigh, the benefits outweigh the risk at 75.
Yes.
Coming to the other P2Y12 inhibitors, there is really nothing much to pick right now, but more and more evidence is towards the more potent drugs like ticagrelor or prasugrel. Clopidogrel has still has probably an indication in patients who have undergone thrombolysis, but there's really not much to pick between the two. The more interesting question you would want to ask is for how long do you want to keep the dual antiplatelet?
Yeah.
So in patients with high bleeding risk, you would want to come off the dual antiplatelet within 1 to 3 months. Patients who don't have a high bleeding risk, probably you can keep them up for 6 months to up to 2 years. Also, would you, as a monotherapy, would you want a P2Y12 or an aspirin? The more and more evidence is towards a P2Y12, like ticagrelor alone. Although just aspirin would, if tolerated, would be a better choice. Yes.
Thank you, sir. What is your say on stopping this aspirin before minor procedures? On how many days before?
Minor procedures before a dental extract, I wouldn't want to stop, especially if the patient has put in a stent or anything else. But if he doesn't have any clear indications, I wouldn't mind stopping an aspirin. Regarding major surgeries like abdominal surgeries or anything, you would really want to weigh the risk of stent thrombosis versus a bleeding risk.
Yeah, thank you very much. What is your opinion on Treat DM 2025, sir?
Great, because I get to meet a lot of different kinds of people. Otherwise, I would probably meet only a cardiac electrophysiologist all day. So it kind of broadens my horizon. So I have to kind of thank you for that.
Thank you very much for your insights.
Thank
you very much.
Take care.